Hi, everyone. Good morning and welcome. My name is Abby Tynan, and I am with the CSU Health Network, and we are every student's on-campus home for health and well-being at CSU. I do use she, her pronouns. And today I'm going to be going over the services that are provided for you at the CSU Health Network, and I'm also going to review the new student requirements and recommendations. We do have a fair amount to cover today, so I'm going to ask that you hold, I guess, your expectations for question answering until the end. If you do have a question throughout the presentation, please feel free to chat it in the Q&A, and then I will review that at the end of the presentation. And if I can't answer that for you, I will make sure to direct you to someone who can. So all of the information covered in this presentation is on our website, which is health.colostate.edu. And that's just a great resource for you at any point, whether it's after this presentation, before you start at CSU, or anytime during this semester. There's just a wealth of information on that website. So please make sure to jot that down, health.colostate.edu. It'll be throughout this presentation as well, but it's just a great resource. So let's dive on in. Just a second. Okay, so who we are. So we will be covering 4 service areas today in this presentation. So if you're thinking, what is the CSU Health Network? We are your on-campus home for healthcare at CSU. So we are basically your doctor's office while on campus. So we do offer medical, counseling, health education and prevention services, and then business services. So those are our 4 main service areas at the Health Network. And as I mentioned, we'll be diving deeper into those as the presentation continues. So a little bit about the CSU Health Network. So you do have full access to all of our services regardless of your insurance plan. That includes our medical, counseling, and health education and prevention. So you have access to all of them. And we're truly here to support you and make sure that you are successful during your time at CSU. We do like to consider ourselves as kind of your first stop for medical and counseling needs. And we are every student's on-campus home for healthcare. And one thing that's different about us in comparison to other universities is that we pride ourselves on integrated care for the whole student. So we don't like to look at you as pieces and parts of yourselves, but as one larger unit. And so unlike other colleges and universities across the country, we actually have integrated medical and counseling services all under one roof. We also know that health and well-being is such a critically important part of your experience and your success during your time at CSU and on your path to graduation. And I want to ensure you that you will be set up for success, and we feel like we have the services to meet your needs during your time at the university. One question we always get at some point during orientation season is, do you have real doctors, or are these students practicing on students? And the answer is yes, we do have real doctors. They are board certified practitioners that go through rigorous accreditation processes each year. And so if you're curious about the providers at the CSU Health Network, please visit our website. You can go to the About Us section on our homepage and then click on Meet the Staff, and you can read all about the providers at the Health Network. Also, one thing that is unique about healthcare in the United States, maybe in comparison to your home country, is that all of your visits are private and confidential. So no one is going to know about the services and the care that you receive unless you want them to. All right, a little bit about our medical services here. So we do have a ton of medical services all under one roof. This includes general medical services, specialty medical services. We have a dentist, we have an optometrist. We also have a pharmacy on our first floor. So if you are currently taking a prescription medication or even just need over-the-counter medication, we have that right on campus for you. We have an X-ray, a laboratory, physical therapy. We have an immunizations and allergy shot clinic right on campus, women's care, and then of course we can help you navigate any health questions that you have or provide referrals for services that maybe we don't offer but someone in the community has. So if you're interested in scheduling a medical appointment, you can schedule an appointment online or by calling. We do offer walk-in appointments typically, and some of this information that I am providing to you is kind of this pre-pandemic message. So I would like you to kind of get an idea of how our services work in general, and then I will provide clarifying information if anything has changed because of COVID-19. So in general, if you're interested in accessing our medical services, you can make an appointment online, you can call, or you can walk in. While students are certainly best served by making appointments, if you do need immediate medical attention, maybe you're injured, you're vomiting, whatever the situation may be, you can walk in and be seen day of. We do ask students always to bring their CSU student ID with them to their appointments, as well as their insurance card. And then out-of-pocket costs, so what you will pay is just dependent on your health insurance. And so I had mentioned that some of these things may have changed because of COVID-19. So right now we are not doing any walk-in appointments, and we are asking students to always call the CSU Health Network before coming in. This is just to make sure that we are currently offering the service that you're needing in person, or maybe that's via telehealth. It just kind of depends. And then of course we want to be screening folks for symptoms of COVID-19 as well. So we're currently offering some of our services in a combination of ways. As I've mentioned, some are in person and others are by phone or secure video conference. And this is just to make sure that we're in line with the current health requirements in Larimer County. And while, of course, like everyone else, we're not exactly sure what the future is going to bring, what the spring semester is entirely going to look like, we don't expect any of these services to not be available to students or to go away. It just may be that some are available in person and some are available by video chat or by phone. So I know that you will probably have questions as the start of the semester grows closer, or even maybe throughout the spring semester. And so please just check our website or give us a call if you have questions. We like to keep our website as up to date as possible, so that will always reflect the most current information as things maybe evolve week to week as public health guidelines change. So just check that, and we will make sure to keep that updated for you if there's any changes in our medical services because of COVID. Okay, moving on to our counseling services. So we are very proud of the culture of help seeking that has been embraced by CSU. This is all the way from the president's office to faculty, staff, and students. And we like to tell students that it's never too early and it's never too late to access mental health support and mental health care. And so by paying student fees, all CSU students get access to a wide range of mental health support services. And this includes skill building workshops, group therapy, individuals and couple sessions. We have information on substance use, all sorts of things for you. And so this is all covered under your counseling fee. So in essence, it is free of cost for you to access these counseling services. So if you are interested in accessing counseling, you can come typically in non-COVID times to our physical location on campus, and our licensed professionals will work closely with you to determine the services that are right for you, given your goals, your preferences, and then of course what's clinically appropriate. So diving in now more to how to access counseling services, especially with some caveats here with the pandemic. So this slide design in general goes into depth on how to access counseling services, but it is a little pre-pandemic messaging. So if you are interested in accessing counseling services, the first step is always to come and see us. It's just that right now, coming and seeing us means please giving us a call. So we do have folks that are working our phones during our drop-in hours, and you will talk through over the phone what your areas of concern are, your goals, your history, your unique circumstances, your identities, and we will work with you to create a wellness plan or kind of next steps that best fit your needs and preferences. And so this could be individual counseling, it could be groups and workshops, online resources, maybe even resources across campus. So if you're interested in accessing counseling, the best thing to do is give us a call, and we will make sure to connect you with the services that are right for you. And at the moment, all of our counseling services are being provided by phone or secure video chat. And I have a feeling that's probably how it's going to remain for the entirety of the spring semester. So we'll see what happens. Of course, check our website for updates, but definitely give us a call and we will make sure to connect you with someone over the phone or video chat. Okay, so now our third kind of branch of services is our health education and prevention services. And this is our outreach arm of campus. So we're very proud of all of the robust skill building programs and services that are offered through what we call HEPS. We do a lot of work around choice making and bystander behavior. What does it mean to be a good RAM? How do you look out for your fellow RAMs? How to spot a student in distress? And so one of our kind of branches within HEPS is our peer education program called CRUISE. So if at any point during your time on campus, if you hear the phrase RAMs take care, RAMs take action, that has actually come out of our CRUISE bystander intervention work. And so it's just peers working with other peers, talking to them about what it means to make good, healthy decisions, and how to take care of RAMs and how to take action if you need to. Other service areas include, we have mental health initiatives all the way on the spectrum from stress reduction to suicide prevention. We have support on how to quit smoking. We have information on mindfulness meditation. We have substance abuse, whether it's alcohol, drugs, so just substance abuse prevention there, sexual health initiatives. So we have all sorts of outreach efforts that are happening within health education and prevention services that I'm sure you will see at some point during your time at CSU. Okay, so if you have visited the CSU campus, you have probably seen this building. So this is the CSU Health and Medical Center. We're located on the corner of College and Prospect, and we are coming up, I believe, on our 4th year in this building. So I can't believe that time has flown that quickly. But we are your home for health with all of those medical counseling and health education and prevention services that I just touched on. They are all under one roof here. So we kind of like to think of ourselves as our one-stop shop for health and well-being on campus. And so if you are interested in further information exactly on how parking, transportation, access, and hours of operation works, you can visit our website, but I will touch on just a couple of things right now. If you are on campus, I do want to note the Around the Horn stop. For folks that are living in residence halls, Around the Horn can be super helpful. That's a campus busing system that has numerous stops throughout campus, including outside of the CSU Health and Medical Center. So if you aren't feeling well enough to walk, bike, longboard, you can take the Around the Horn stop, and it will drop you off right outside our building. We also have our patient client parking. It's one of the more, I think, kind of unique features of our facility. When we were building the CSU Health and Medical Center, we didn't want cost or availability of parking to be a barrier to students accessing our services. So I believe our lot is the only free lot on campus. So you can park in our lot for free as long as you have an appointment at the CSU Health and Medical Center. Again, things look a little different with COVID, so always make sure to call before coming into the Health and Medical Center, and our website and our phone number is at the end of this presentation. Okay, so ultimately, why are we here? What is our point, right? So we want to help you with your medical and mental health needs so you can succeed during your time here at CSU. We want you to get healthy, we want you to stay healthy, and we truly feel like we have the services to support your well-being during your time at the university. So when are we open? We are open weekdays, Monday through Friday. Our medical services are open about 8 to 5, Monday through Friday. And then our counseling services are open also 8 to 5 with extended hours on Tuesdays and Wednesday evenings. And those are for our groups and workshops. So any changes to those hours, again, will always be listed on our website, health.colostate.edu. We do offer some after hours and emergency care services that I'm going to be mentioning in the coming slides. So we do offer a phone helpline for night and weekend urgent problems that you will have access to. And ultimately, I just want to encourage you, do not wait, come early when problems are maybe just starting to happen. Especially, we know that mental health is just such a priority and can be really hard, right? If we're being honest during a pandemic. And so I strongly encourage you, if you've been struggling, please reach out. Our counselors and mental health professionals are here to support you while you're at the university. So how can you reach us? The first thing you can do is you can call us to make an appointment. So our phone number is listed on screen there. You can walk into our offices, and then you can also make an appointment online. However, I do want to note that our online appointment scheduling are for our medical services only. We do not offer any online appointment scheduling for our counseling services. And this is just to make sure that we are matching you with the correct counselor and that you can kind of get on a regular schedule with the counselor that you will be seeing. And again, just to continuously reiterate, please always call the Health Network before coming in during the COVID-19 pandemic. Okay, so a little bit of after hours and emergency care information here. So as I had mentioned, our general office hours are 8 to 5, Monday through Friday, with adjusted hours during breaks. And then counseling does have a few weekend options, and you can check our website for the most current hours of operation. However, we strongly encourage you to come and see us first. We are on campus, and we do have all of those medical and counseling services that I had mentioned at the beginning of this presentation. But that being said, what do you do after hours or on the weekends when the CSU Health Network is closed? We do offer a variety of phone helplines. So we have our 24/7 nurse helpline. So if at any point when we are closed, these helplines are staffed by some of our nurses at the health network, and you can call them and speak with them and tell them about your symptoms and what you're experiencing, and they can guide you whether it's appropriate for you to wait and seek care maybe in the morning when the CSU Health Network is open, or if you need to go and see an after hours or an urgent care facility in the Fort Collins area. We also offer a mental health crisis intervention line, and you can call that 24/7 if you are ever experiencing a mental health crisis, and you can talk to someone directly on the phone. So say you wake up one morning on the weekend and you're not feeling well, and you call the 24/7 nurse helpline, and they suggest that you go into an urgent care or emergency room facility in Fort Collins. We do have a full list of emergency room facilities in the area on our website, which is health.colosite.edu. So I definitely encourage you to go and check those out. And I do want to mention that emergency care does look different in the United States than it does in other countries. It can be quite costly. So we definitely encourage you to come and see us first if we are open, and then we can kind of guide you through that nurse helpline if seeking urgent care in the community is right for you. And of course, in the event of a life-threatening emergency, please call 911 and they will help you. And here is some contact information for some emergency rooms in the Fort Collins area. Poudre Valley Hospital is probably going to be the closest on campus for you, or closest to campus for you. And then we have the Banner Fort Collins Medical Center as well. And again, all of this information is listed on our website on our after hours and emergency care page. So as I had mentioned, things do work a little bit differently with the healthcare system in the United States. And so you may have questions with how will you pay for these services? So your health insurance does help pay for medical services that you have accessed, but what you owe depends on your health insurance plan benefits. The exception to that, again, is of course counseling, whereas counseling services are covered under your student fees, and that allows you to have full access to all of our wide range of mental health support services at no additional cost to you. And we'll be going over health insurance a little bit more in detail later on in this presentation. So I do have a couple little pop quizzes here. I will probably be making a little extra work here for Bronwyn, so I hope that you don't mind. But if you wouldn't mind typing in the Q&A your answers to the following questions, and then hopefully Bronwyn will be able to clear those out. I know for some folks, maybe it's in the morning, in the evening. For me, it's 10:22 in the morning, so we're kind of starting off our day with a little pop quiz here to make sure that you've understood everything in the presentation so far. So question 1, what services are provided at the CSU Health Network? Is it A, medical services, B, counseling services, C, health education and prevention services, or D, all of the above? So feel free to chat your answer in the Q&A, and you can let us know here, and I'll pop that up on my screen too. Seeing a lot of D's come in. That's good. So the answer to this question is D. All of the above are provided at the CSU Health Network. There we go. So CSU Health Network is every student's on-campus home for medical and mental health needs. All right, next question, question number 2. Do you have to be really upset to see a counselor? A, yes. B, no. C, they said no, but I think you do. What are our thoughts here?
And Abby, for this one, you're going to have to scroll all the way to the bottom while I continue clearing out.
Sorry.
It's okay. It's okay. Just let me know.
Yes, thank you. So it looks like we've been getting some answer B's popping in the chat. That is correct. You do not have to be really upset to see a counselor. Our counselors are truly here to help you with your problems, whether big or small. We just really want you to know that you have the support that you need while at the university. So please, no problem is too big or too small for us. And like I said, we like to encourage folks, it's never too early or it's never too late to get the mental health support that you need. Okay, question number 3. What are reasons to come visit medical services? A, a bad sore throat. B, headaches. C, sickness. D, questions about women's health. Or E, all of the above. Oh, we have some fast fingers here this morning. I'm getting a lot of answers coming in. E, all of the above, that is true. If you're not feeling well, if you have health questions, whatever it may be, please come and access our medical services. Of course, in a non-pandemic year, you could come physically see us at our facility. As I've been mentioning, give us a call and we will help you, whatever that is. Again, even if you just have a question, we would love to try and help you with that. Okay, question number 4. Should you go to the hospital if you have a life-threatening illness? A, yes. B, no. What are our thoughts here on this one? All right. They're all kind of trickling in here. I'm seeing a lot of A's. That's good. So the answer is A, yes. So if you have a life-threatening illness, please, or an emergency, please go to the hospital or you can call 911. Okay, question number 5. Who will we tell about your visit? So if you come and utilize the services at CSU Health Network, who will we tell? Your parents, your teachers, your friends, or none of the above? What's the answer here to question number 5? All right, I just saw, we've got a variety of questions here, but one that just trickled in is answer D, none of the above. So in the United States, we have what's called HIPAA, and so that is our Privacy Act. So we actually do not tell anyone about your visit. So CSU Health Network is completely confidential. We won't tell anyone unless you want us to. Okay, so way to go. You've passed the pop quiz. So now we get to move on to the next section of the presentation, which is our new student checklist. So thank you to Bronwyn for taking the time to clear all of these questions out of here. I appreciate you doing that work this morning, and thanks for everyone that participated in those little pop quizzes by answering questions into the Q&A. Okay. So moving on to the new student checklist. And again, all of this information is on our website, as you can see on screen, health.colostate.edu. And then I will be referencing RamWeb a couple times throughout here. So that is just ramweb.colostate.edu there. Okay, so the first kind of checklist item here on the new student checklist is to submit your immunization records. So Colorado law does require that every student submit proof of 2 measles, mumps, and rubella vaccinations. And then for folks who are living in student housing, Colorado law requires students to submit proof of the meningococcal vaccination given within the last 5 years. So that's kind of the important note there. The meningococcal vaccination has to be given within the last 5 years. Some more detailed information about this is listed on our website, health.colostate.edu/new student checklist. You can see the URL on screen there. All immunization records are submitted online through the CSU Student Health Portal. So we do not accept any paper submissions. You can either scan your immunization records or take a picture of them, and then you can submit them online. And again, there's detailed instructions on our website. The immunization requirement, the deadline to meet that is the first day of classes, which is Tuesday, January 19th, 2021. And so it's really important that you get these immunization records in by your first day of class, because if you do not meet that deadline, then you will have a hold put on your student account and you will not be able to register for classes for the following semester until you submit your immunization record. So please make note of this in your phone and your planner, whatever works best for you, to make sure to have all your records turned in by the first day of class, Tuesday, January 19th. Okay, The next one here is about completing health forms. So there are two things here that I want to note. One is the tuberculosis assessment, and the other is our health history form. So while these are not necessarily required, they are highly, highly recommended. So you can complete the health history and the tuberculosis screening forms online by logging into your health portal at health.colostate.edu. And I'm going to walk you through how to access that here in a couple slides. Of course, there's detailed instructions also on our website about how to meet this. Your tuberculosis assessment is just a couple questions that you answer about your potential exposure to TB. And then your health history form is similar to any form that you would maybe fill out at any other doctor's office, just talks about your complete health history. So that way we have a good idea of your background when you come in to see us at the CSU Health Network. We know if you've had any illnesses in the past or any chronic health conditions. So that just helps us make sure that we can care for you most effectively. Again, the deadline to complete these health forms is the first day of classes, which is Tuesday, January 19th. Okay, so I want to walk you through here how to access our CSU Student Health Portal. So this is a screenshot of our website, health.colostate.edu. And as you can see, we kind of have that bluish green bar along the bottom. And so that's our quick links panel. And our second link there is to the Student Health Portal. So if you go to our website and you click the Student Health Portal, it will then take you to this page, which is portal.health.colostate.edu. And on this page, you will log in with your e-name and your password, same like you would log in to RamWeb or any other kind of EID needed website on the CSU campus. So you log in with your e-name and your password. It will take you to this page here. So you can access the forms that I was talking about through the My Forms tab at the top of the page. Or as long as you have yet to meet this requirement, you will always have this "You have pending forms" notification at the top of the page. So that's kind of a good way to know, have I met this requirement, or is this something that I'm still needing to do? So once you have your forms all ready, for example, the immunizations form, you took a picture on your phone, you're ready, you can upload it to this document upload button on the top of the screen. And I do want to note, this is definitely caused some, I think, maybe confusion in the past, and I'm hoping that mentioning this here will kind of help folks out. So we do require that your immunization forms be translated into English. And so if you have questions about that, let us know, but your immunization records do need to be in English when you submit them to this document upload button on our website. So just make sure to note that there. Okay, so before I continue on with providing some important information about the CSU Health Network, I do want to play this quick video about the overview of the US healthcare system. So it's just going to take a couple minutes and I'm going to get that started right now.
The U.S. healthcare system offers some of the best medical care in the world, but it is complex, difficult to navigate, and often very expensive. The U.S. system will also likely be very different from the healthcare system you are used to back home. In this section of the video, we offer a few simple tips. First, like most Americans, you will need a private insurance plan, either through your school or one that you purchase directly. There is no universal access or national health care like many countries offer. When you seek any medical care, the provider you choose, hospital, doctor, or clinic, will look to you and to your insurance carrier to get paid for their services. There will be no payment from the government, and healthcare can be very expensive in the U.S. Here are a few recent real-life examples. Appendicitis, $60,493. Fractured humerus, $47,445. Fractured clavicle, $18,393. Car crash or serious illness, $150,000 plus. We hope by now it's clear why you need insurance. However, even with insurance, you should still be prepared to pay some portion of the cost of your medical care. Cost sharing is an important element of the U.S. system. So medical care is never entirely free, and each time you access the system, you should expect some cost. While your insurance plan will typically cover the majority of expenses, there will be copays, deductibles, co-insurance, excluded charges, or some combination of these items that will ensure that you pay something. Carefully review your insurance documentation so you understand how these payments work for your plan.
Okay, so I know that was probably a little overwhelming. It's certainly, I feel like, a little bit of an exaggerated video, but the point is to just kind of understand that United States healthcare system is different from the healthcare systems that you may have experienced in your home countries. And so um, in terms of using health insurance at the CSU Health Network, all enrolled students do have full access to all of our services regardless of your insurance plan. So one of the requirements for new students is to fulfill the health insurance requirement. And so it is required for all international students to have health insurance. That's actually a university requirement. And so in part of being an international student, you are actually automatically enrolled in the CSU Student Health Insurance Plan. And there is a ton of information on that plan on our website. So at the end of this, I will drop that URL into the chat, or maybe the, yeah, I guess the chat, because you don't have access to probably my end of the Q&A. But that way you can read more about the CSU sponsored student health insurance plan. You are billed for the cost of the plan after you register for classes. However, if you do have coverage, appropriate coverage or adequate coverage, I guess is the correct word, from your home country, you can opt out through a waiver process if you can show proof of acceptable private insurance coverage. So there are options for you. I also want to mention that because of COVID-19, we know that some students may be studying at home in their home countries. And if that is the case, that you will be attending spring semester as a CSU student, but studying from your home country, there is actually a waiver on our website where you can say, hey, I'm actually living at home in my home country. I don't need health insurance in the United States for the spring semester. So if, I guess, type in the chat if that is information that would be of use to you, and I'm happy to kind of walk you through that at the end of this presentation. So just know that there are plenty of options for you, but regardless, health insurance is required for all CSU students who are studying at the university. Okay, so as I mentioned, if you do have other insurance coverage that meets the requirements set up by CSU, you can submit a waiver request form. And so what you do is you will submit a copy of your current insurance policy to the CSU Student Health Office. And so the deadline to submit a waiver is Wednesday, February 3rd. Accepted waivers include most employer group health plans, approved sponsor plans, and then individual plans that meet the healthcare reform law. But then non-accepted waivers include short-term plans such as international student plans, foreign plans, or individual plans that do not meet the healthcare reform law. And so in the past, we've been fortunate enough to have a student health insurance representative on these calls. Unfortunately, one was not able to join us today, but I can certainly give you their contact information if you have specific health insurance questions that I'm unable to answer myself at the end of the presentation. Okay, so a little bit of information about the CSU Student Health Insurance Plan that all international students are enrolled in. So it does pay all costs for most medical services within the CSU Health Network. So you have to come and access services at our facility in order for all of costs for most medical services to be covered. Then it covers 60 to 80% of most medical costs at a hospital or a medical clinic. So this is anywhere outside of the CSU Health Network, but this is after you pay a $500 deductible. And then a great bonus of the CSU Student Health Insurance Plan is that you do get 250 flex dollars. And so this is just kind of like money that you can use at the CSU Health Network for non-covered services. So whether that's dental, optometry, you have a couple different options that you can use that on. However, the CSU Student Health Insurance Plan does not pay for, as I had mentioned, dental care, vision care, elective services, non-medically necessary services, massage therapy, or over-the-counter medication. So the flex dollars can kind of help cover some of those services, but for the most part, those are not covered under the CSU Student Health Insurance Plan. Okay, so like I mentioned, I'm happy to try and answer your insurance related questions at the end of this, but at this point, I'm going to move on to our next requirement, which is completing online modules. So alcohol, EDU, and sexual assault prevention are required for all incoming students. So alcohol EDU provides personalized feedback that encourages students to consider their own drinking decisions and those of their peers. And sexual assault prevention educates students on issues associated with stalking, relationship violence, and sexual assault. Both of these modules, alcohol EDU and sexual assault prevention, are required, and the deadline to complete these is February 3rd, or it should be the first day of classes. I'm sorry. So that's, I think, January 19th. So excuse that deadline. I apologize for the error. So those are both due by the first day of classes. If you do not complete those by the first day of classes, you will have a hold put on your student account, and you will not be able to register for the next semester of classes until those modules are complete. So make sure that you make note of those and complete alcohol, EDU, and sexual assault prevention by the first day of classes. Here's another optional module for you to consider, which is Achieve Financial Wellness. And it just teaches you more about finances and how to manage your money in college and beyond. So while this is not required, it's certainly recommended, and we encourage you to go and check that out. You will receive an email alerting you that alcohol, EDU, and sexual assault prevention are open for student access. And when you receive that email, you can log in directly through your RamWeb account. And you can access all three of these modules: alcohol, EDU, sexual assault prevention, and Achieve, all through RamWeb. Again, you'll get emails alerting you that the programs are open. And if you do not complete those by the first day of classes, you will have that registration hold. Okay, the next thing here, just kind of for your benefit, is you at CSU. So this is our online student success portal. It basically connects you to personalized on-campus and online resources during your time at CSU. So it is confidential, and it provides customized feedback for you to meet your goals or address your concerns in 3 areas, and that's succeed, thrive, and matter. And so we encourage students to go online and set up a You at CSU profile before you even, start your time here at CSU. And you can actually set up your profile right now through RamWeb, and we encourage you to just start exploring all of the options that are available to you on You at CSU. So at this point, that wraps up the new student checklist portion of the presentation, which is kind of the final thing that I had to discuss with you all about. So if you have more questions, or if you're looking for some specific detailed information about any of the new student checklist pieces that I mentioned, you can go to the URL on screen, and it will provide you with kind of step-by-step information on how to complete those requirements here. So it's health.colostate.edu/new student checklist. So I do want to reiterate, we are here for you, whether you are studying from your home country, if you will be in Fort Collins, whatever your situation looks like for the spring semester, we want you to know that you are supported, and that whenever you make it to campus, we truly have the services and resources to have you succeed during your time here at CSU. So please reach out if you need anything, come and see us. And now I will kind of open it up for questions, and I just want to thank you so much for taking the time to join this presentation today. So I will stop my screen share, and I will go into the Q&A and do my best to answer the questions that I can.
Abby, as you answer those questions, do you want me to clear them out and you can just focus on answering them?
I can actually clear them if that's okay on my end.
Yeah, go for it.
Okay, thank you. I appreciate you offering. So the first question that I have here is, as an international student, how do I buy insurance for my dependents? So that's a great question, and one of those that I wish we had one of our insurance reps here for. Unfortunately, the CSU Student Health Insurance Plan does not offer coverage for dependents. It only offers coverage for CSU students. And so if you're interested in buying insurance for dependents, I believe you have to go on the, I think what it's called, like the open marketplace. And so for this one, I'm going to eventually type a URL into the chat. So you can call our student health insurance office, tell them what you are experiencing, and hopefully they will be able to better guide you on how to buy insurance for dependents. Okay. So the next question is, have you sent any email regarding taking vaccines or immunizations? I guess I'm curious if you are referencing the COVID-19 vaccine, or if you're talking about the immunizations requirements, since those are kind of 2 different things there. So if you are talking about the immunizations requirement, you will not be receiving any emails from us. It's just kind of an expectation that folks meet that requirement. If you do meet that requirement, you will not have any follow-up communication. We will only contact you if we have questions about your immunization. So if you have submitted your immunization records and you haven't heard anything from our facility, then that's good news, and it sounds like everything looks good with your immunization records. If you are referencing the COVID-19 vaccine, I, at this point, don't have any information about when that is going to be offered to CSU students. I think that's definitely still in kind of the early rollout phases in general in our country, and so we're all still just waiting for more information. But as soon as the COVID-19 vaccine is available to students, I'm sure you'll be hearing a lot from us encouraging folks to get the vaccine. So I hope I answered your question. If I didn't, and if you want some follow-up information, please feel free to type that back into the Q&A. Okay. Can you take a TB test after coming to the university? Yeah, you can come into our immunizations department and get a test for TB. If you are referencing the TB screener questionnaire that I talked about in the requirements for the new student checklist, that's actually not a physical test. It's just a couple of questions online to assess your potential exposure. So you do not need a physical test in order to meet that requirement. But if you are interested in getting an actual TB test, you can call our facility and make an appointment. Yes. Okay. So this next question, hi, can I submit a waiver for just part of the spring semester if I'm arriving in the United States in the middle of the term, March, for example? And the answer is yes. I'm assuming you're talking about that COVID-19 international waiver that I was talking about. So I'm going to find the URL in a few, and I will type that into the chat for you. So how the COVID-19 international waiver works is if at any point during the spring semester, you know that you're going to be studying in your home country and that you will not need health insurance coverage in the United States, you will go on and you will fill out this waiver on our website saying, hey, I'm living in my home country. I don't need health insurance coverage right now. However, as part of that, you are also agreeing to tell us, if I come to CSU at any point during the semester, then it's then you need to reach out to the CSU Student Health Insurance Office, as well as international programs, I believe, and let us know that you've now moved on to campus, that you're living in the United States, and then at that point, we can set you up with health insurance coverage in the United States. So that was a long answer to your question, but the answer is yes, you can submit a COVID-19 waiver for just part of the spring semester. And again, I'll pop that in the chat as soon as I'm done answering these questions. Okay, where can I find the waiver for students studying from home? Let me see if I can actually just get that real quick. So hold on 1 second. Okay, so in the, oh, interesting. Okay, so Bronwyn, I don't know if it's possible to start the chat again so I can chat out this URL to everyone. It seems like I can only give the URL to folks who are asking the question.
I can send it to everyone.
You can send it to everyone. Okay, so I'm going to be providing this to Bronwyn at the end of this, so look out for an email later today or sometime this week, I guess, with that information. But for the meantime, I will at least type the URL to folks who are asking that question. So it's coming to the rest of you soon. Okay, so I've already been in the USA for 2 years and I've completed my master's degree. It sounds like maybe another university in the United States. In that case, do I still need to get your vaccination? So if I'm understanding your question correctly, it sounds like you've attended a different university in the United States, and so you're wondering if you still need to get those vaccinations in order to attend CSU. So you only need to get those vaccinations once, or say if you're living in on-campus housing and you need the meningococcal vaccination and it's been 6 years, it needs to be within those 5. So what you need to do is you just need to provide proof to CSU that you've had those vaccinations. You do not need to receive the vaccinations again. You just need to show us proof that you have received them. So you should have some sort of immunization record showing that you have received the MMR and the meningococcal vaccination. So all you need to do is provide that to the university, and then you will be good to go for that immunizations requirement. Okay, so the next question, if I don't have immunization records, can I receive my vaccinations at CSU? And the answer is yes. If you have not gotten any of the required vaccinations and you are wanting to receive them at the health center, we can certainly give them to you. Please just give us a call to make an appointment to receive those vaccinations, and you can get all of those directly at our facility. So to the person who is asking this question, I'm going to type our phone number in there, and you can give us a call and to set up an appointment to receive your vaccinations. Okay. Interesting. Okay, so I'm an online student and I'm taking classes from California. Do online students need to go through all of these formalities? So there are different requirements for online students. So this presentation is certainly geared to students who plan on studying on campus at the Fort Collins location of CSU. So while I wish I had the exact answer to your question about online students, unfortunately, I don't know off the top of my head. Maybe Bronwyn has the answer to this, but I would, I will find the answer to your question. But I'm going to say no, like I know if you are not going to be studying on campus and you're an online student, you don't need to meet the immunizations requirements, for example. So let me find out some more information and I'll get back to you. So the next question, when will we be getting the COVID vaccine? So again, great question, a question I think a lot of us have. Unfortunately, the answer right now is I'm not sure. In terms of rollout, I know some senior citizens are receiving it and healthcare workers and maybe teachers, at least in the state of Colorado. And so at this point, we're just kind of waiting to see when it becomes available. I don't believe that the health network even has access to any vaccines yet. I believe those are being managed by the Larimer County Health Department. So unfortunately, I don't have the answer, but I promise you, as soon as we do have information about when students can receive their COVID-19 vaccine, you will definitely be hearing from us. Okay, so it says, so far I have not received any emails regarding the alcohol EDU modules. By what time can we expect it? So typically we send those emails about 30 days before the start of the semester. Obviously, we are definitely within that time frame here. So I know we've been having some technical issues with, it's called EverFi. That's the platform that these modules are on. I would encourage you, if you have been waiting to receive an email for these for those modules, I would encourage you to go into RamWeb and see if you just happen to already have access to them, and maybe there was just kind of an error in the system. If you do not if you can still not access them within RamWeb, definitely please give us a call. I will type our phone number into the chat for the person who is asking this question. And I will just hope that you have access over RamWeb, but I will also let our manager who sends those emails know that you have not received them, and then hopefully that can notify her of a potential error in the system as well. So thank you for letting us know, and I just recommend going into RamWeb and checking if you have access already. It just may be kind of a glitch.
Hey, Abby, just a quick question.
Yeah.
Do grad students have to do the alcohol module?
So yeah, thank you, Bronwyn. That's a great question. So if you, I believe, are 23 or older, you do not have to complete the alcohol EDU module. That is not required. However, if you are under the age of 23 and are a grad student, you will still need to do that. However, sexual assault prevention is required for all students at the university, regardless of your age. Okay, one more question. Does CSU health insurance cover medical expenses outside of the United States? So The CSU Student Health Insurance Plan does allow, does provide coverage in countries that are outside of the US. I would strongly encourage you to go and read the brochure a little bit. I will find that link and I will drop it into the box. But we do provide coverage not only at the CSU Health Network, we provide coverage off campus throughout the state of Colorado and the United States and worldwide. So the short answer to your question is yes. And then I would just encourage you to look up the specifics of that, and I will drop you a link to your question. Okay, so, oh, interesting. Okay, so it says, I've received an email a few weeks ago to access My AmeriBen for school insurance. So for those of you who are unsure what My AmeriBen is, they help manage the CSU Student Health Insurance Plan, and you will be getting like an insurance card through My AmeriBen. It says, however, it won't let me sign up as instructed. Who do I contact about that? So, that's a great question. I will give you the email of our CSU Student Health Insurance Plan office, and I will type that answer for you. If I will also provide that to Bronwyn, so that way when she sends a follow-up email to all of you with the information on the COVID-19 waiver, you can have access to that as well. Okay, so the question is, if I am immune to measles and mumps, can I get the MMR test at the CSU Health Network, or do I need to do this from my home country? So yes, you can get the immunity test done at the CSU Health Network. It may be easier for you to get it from your home country. It's really whatever your preference is, but yes, you can receive that at the Health Network. Okay, so the next question is, does the CSU Health Network insurance cover COVID-related issues such as tests, treatment, etc.? Let me pull that information up real quick so I can get you that. So I will say some of this out loud, and then I'm also going to drop a link for you, Nelson, in the chat. So for COVID-19 testing and treatment, this is all on our website here. It says all COVID-19 testing done in network, including any office visits or urgent care visits, is covered with no out-of-pocket costs through the end of January. The testing must be ordered by a doctor. And then COVID-19 treatment is covered with no cost sharing in network, also through the end of January. So it sounds like things will be changing come February. Antibody or non-medically necessary COVID-19 testing is not covered. And then if any of that changes, we will be updating our website. So I am going to type that answer for you in the chat. It's about midway down the link that I'm sending you on the page. Okay. So this next question is, I was an N2 student before, so I have already submitted my immunizations form and my health forms, and I can also still see my immunizations form. So do I have to resubmit? No, if we already have your information on file, you will not need to resubmit that. If you've already been any type of student at CSU, you should be good. Okay, so the next question is, if I'm going to be attending classes from my home country, do I still need to meet the immunizations requirement? And the answer to that right now is still yes. The point of the immunization records, it kind of has always functioned that this is a one-time requirement, and we are under the assumption that at some point during your time studying at CSU, you will probably be on campus. So if you are a first-year student and planning on attending 4 years, we are assuming at some point, right, that things will kind of be back to normal and you will be on campus. So that is why that is required. So if you are still, if you're going to be studying from your home country, you will still need to submit that immunizations requirement. So please take note of that there. And that's a really great question, and I appreciate you asking that. Okay, next question, can we receive the meningococcal vaccination on campus? If yes, what's the deadline? The answer is yes, you can receive the meningococcal vaccination on campus. You will just need to call and make an appointment to receive the vaccine. And then the deadline in terms of the requirements for the new student checklist is the first day of classes. However, as soon as if you are unable to get an appointment by the first day of classes, that hold will be taken off your account as soon as you receive your meningococcal vaccination. So if you're unable to get in until like the first or second week of classes, as soon as we have proof that you've received your vaccination, any hold on your account will be removed within 24 to 48 hours. But yes, you can get it on campus, and the deadline for the requirement is the first day of classes. Okay, so the next question is, I have insurance from my sponsor. Is that acceptable? So there are a lot of kind of nuances between different insurance plans. So I don't have enough information that I need right now to know if your specific plan is acceptable. I'm going to type the email address from our student health insurance office to respond to your question. And if you can email them with the specifics of the insurance that you have for your sponsor, they will be able to help you and let you know if that is acceptable for that meets our student health insurance requirement. So I encourage you to email them, and they'll be able to help you better than I can. But thank you for your question. Okay, I already answered that one. Okay, so the question is, when will the CSU health insurance plan start? So great question. I'm just looking at the website here. So the coverage dates for that already started on January 1st. So the plan is already effective. So as long as you have enrolled in it already, you can already begin using it. So if you are enrolling in just the spring semester, the coverage dates are January 1st through July 31st. And if you are interested, actually all international students are already automatically enrolled, so you should be good to go, and you have access to all of your benefits already. Okay, so the next question is, how much does the meningococcal shot cost? So great question. This does depend on your insurance plan. So if you have a plan from your country or from a sponsor or one of those approved plans that's not the CSU health insurance plan, it's going to be up to that health insurance company how much they're willing to cover. I believe the meningococcal shot does not cost anything under the student health insurance plan. If it does cost something, it's going to be like very small. And as part of the student health insurance plan, you get those flex dollars. And I believe the meningococcal vaccination is covered under those flex dollars too. So you shouldn't have to pay anything for the meningococcal vaccine if you receive it at the CSU Health Network and you have the CSU student health insurance plan. Okay. So next question, it says that it was mentioned that all students living in student housing, whether it's the residence halls or university apartments, must provide proof of the meningococcal vaccine. This person says, I am staying at the University Village apartments. Do I need to provide proof for the meningococcal vaccine? So the answer to that question is yes. The University Village is still considered on campus or CSU housing. And so because of that, you will need to provide proof of the meningococcal vaccination. Okay, so the next question is, where can we get our COVID test done if it's ever required? So if a COVID test is ever required by the university, you will be getting contacted by the university and they will give you specifics on how to get tested. So at this point, testing at the CSU Health Network for COVID is only happening if it's being ordered by a doctor. So if the university is ordering your tests, you will be getting communication directly from them, telling you with instructions basically on how to get tested and where to get tested. So if you are ever required to get one, there will be information when you are contacted on how to get tested. Okay. So the next question is, are there any other forms like consent for treatment, notice of privacy practice, and office policies that I need to fill out before any deadline? The answer is no, there is no deadline for any of those other forms. I believe our privacy practice and our office policies, you are provided those at your first visit. So at that point, you will be signing those forms. Same with consent for treatment. So you will just be receiving those if you ever access, any of our services, but there is no deadline for filling those out. Okay, so this next question, good question. I'm a public health student and my immunization forms were submitted to the Colorado School of Public Health at the University of Colorado at the time of my admission. Do I need to again submit my form to CSU? The answer to that question is yes. Unfortunately, the Colorado School of Public Health is a wonderful collaboration between different universities in the state of Colorado, but for whatever institution you are studying at for that semester, you will still need to meet those requirements. So unfortunately, the University of Colorado Anschutz Medical Campus, it sounds like you already submitted your medical record or your immunizations to, that is completely separate from CSU. So you will need to submit your forms again to Colorado State. Okay, so is the meningococcal vaccine required for graduate students staying in University Village apartments? The answer is yes. Apartments are still considered on-campus housing or university housing, so you will need to receive the meningococcal vaccination. Again, does health insurance cover the cost of meningococcal vaccination? If you have the student health insurance plan, yes, it should. If you have a plan from your country or something else, you will have to contact that plan to see the coverage. So my answer to that is it depends. Okay, just a second here. I'm looking up the answer to the next question. Okay, so the next question is, how much does the meningococcal vaccine cost at the health insurance if you do have the CSU health insurance plan? If you do have the CSU health insurance plan, I believe it should be a covered benefit for you. So you will not be needing to pay anything out of pocket for that. Okay. Just want to confirm. Okay. All right. Okay, so the next question is there any way to use the CSU health insurance plan, as I haven't received any information about CSU health insurance? I'm unsure who asked this question because it came through as anonymous. I think I'm going to need, unfortunately, a little bit more information about that. It sounds like maybe you are interested in enrolling in the CSU health insurance plan, but you haven't received any information about it. If that is correct, I'm going to type an email into the chat for our student health insurance office, and I would encourage you to email them to confirm your enrollment in the plan, or they can also help you with any other questions related to that. Okay. So the next question is, if I am immune to COVID-19, do I have to provide proof at some point in coming to CSU? So at this point, the answer is no, you do not need to provide proof of your immunity to COVID-19 to the university. Maybe at some point that will change, but at this point, the answer is no, you do not need to. Interesting. So the next question is, do my dependents need to show proof of the meningococcal vaccination when they live on campus? That requirement is only for students, so I don't believe it applies to dependents. But I don't think that's possible. I'm going to say no, it's only a student requirement for meningococcal vaccination. Okay, the next question is the CSU student health insurance covered in university fees? The answer is no. The CSU student health insurance plan is not covered by university fees. There is an additional charge to that. If you are curious about the cost of the plan for international students, I'm going to type a response to that, and international students, like I said, are already automatically enrolled. So you will see a separate line item on your university bill for the cost of the student health insurance plan. Okay. Okay. All right, so the next question is, can I have a waiver for health insurance if I don't come to the CSU campus, but I am still attending online in the United States? So if you are not studying in Fort Collins and you are, well, there might be a caveat for that. I am unsure on that one, to be honest with you. I know that for international students specifically studying in their home country, there is a waiver, but I'm unsure exactly how that works if you are an international student, but you are studying from a different state. That does get a little tricky. So I'm going to also type in the email address to our student health insurance plan office that works with that COVID waiver. And I encourage you to reach out to them and tell them of your situation, and they can let you know if that waiver still applies to your situation. Just a second here. Okay. Thank you everyone for your patience as I'm getting URLs and typing in information. The next question is, do our immunization records need to be in the English language? And the answer is yes, the immunization records do need to be in English. Okay, I think at that point, I've answered everything. I will follow up. Actually, I believe I'm hoping I'm pronouncing your name correctly, Kemi. As an international student, how do I buy insurance for my dependents? I'm also going to give you the email address to our student health insurance plan office, and they might be able to help you navigate buying insurance for your dependents in the United States. Okay, and I've already answered the question about online students. I don't believe that's it, that you do need to meet those requirements. I think we're good there. Okay, I think we have caught up with everything. So thank you so much for your time today. I know I believe are a little over on time, so I just want to thank you again. My name, I have another Q&A pop up. Oh, thank you. Thank you. Again, my name is Abby. Please feel free to reach out if you have any extra questions. I hope that you found this presentation helpful. I know there is a lot of information that was just presented to you. So if you need any further info, curious about our services or new student checklist, please again check out our website at health.colostate.edu. I will stay on just for a couple more minutes in case anyone has any last minute questions. And Bronwyn, I don't know if you have anything else you want to add, but I think at that point, thank you so much and feel free to go off for the rest of your day, and thank you.
Yeah, just that we will follow up with that link.
Yes.
So that everyone has that. And then if anyone has any questions that they didn't get answered or you're not sure where to send them, feel free to send them to me. You can just respond to one of my emails and I will forward it on to Abby or someone at the Health Network.
Yep, that sounds great. So Bronwyn, I will send you that link shortly. Again, I will stay on for a couple more minutes in case anyone has any last minute questions. And again, thank you so much. And I just wish you a happy, healthy spring semester.
And right now, just getting a lot of thank yous. So
thank you.
All right. I think we're good.
Okay, awesome.
Yeah, if anyone has additional questions, they can just send them to me. But otherwise, I think we are good to go. And thank you, Abby, for presenting. And thank you, everyone, for joining us.
Thank you so much, everyone. Have a good day.